Ibuprofen Jr Strength 100 mg chewable tablet is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. This form of ibuprofen is intended for use by children. Do not give this medication to a child younger than 2 years unless directed by the doctor. Before taking this medication, always check the ingredients on the label even if you have used the product before. The manufacturer may have changed the ingredients, and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The recommended daily dosage for Ibuprofen Jr Strength 100 mg chewable tablet is determined by your child's age and weight. Always follow the doctor's instructions for the correct dosage and optimal timing. It is important to use this medication as directed and not exceed the recommended dosage. When it comes to using Ibuprofen Jr Strength 100 mg chewable tablet, it's important to follow the directions on the product package. Take this medication by mouth as directed by your doctor or the package label, usually every 6 to 8 hours as needed. It's best to chew thoroughly and then swallow this medication. If you experience stomach upset, you can take it with food, milk, or an antacid. The dosage of this medication is based on your medical condition and response to treatment. To reduce the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. For children, the dose is based on the child's weight, so be sure to read the package directions to find the proper dose for your child. If you have any questions or need help choosing a non-prescription product, consult the pharmacist or doctor. If you are using this drug as needed, it's important to remember that pain medications work best if they are used as the first signs of pain occur. Waiting until the pain has worsened may result in the medication not working as well. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. And if you are using the non-prescription product to treat fever or pain, consult a doctor right away if fever gets worse or lasts more than 3 days, or if pain gets worse or lasts more than 10 days. Some common side effects of Ibuprofen Jr Strength 100 mg chewable tablet may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it is important to consult with your doctor or pharmacist. It's important to note that this medication may raise your blood pressure, so be sure to check your blood pressure regularly and inform your doctor if the results are high. Seek medical attention immediately if you experience serious side effects such as easy bruising/bleeding, hearing changes, mental/mood changes, unexplained stiff neck, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, it's important to contact your doctor or pharmacist. Remember to consult with your healthcare professional for medical advice about side effects. Now let's talk about the uses and important information about Ibuprofen Jr Strength 100 mg chewable tablet. This medication is a type of nonsteroidal anti-inflammatory drug, which may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. The risk may be higher in older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important to avoid taking this drug right before or after heart bypass surgery. In rare cases, this drug may also cause serious bleeding from the stomach or intestines, especially in older adults. If you experience severe stomach pain, black stools, vomiting that looks like coffee grounds, chest pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, you should stop taking ibuprofen and seek medical help immediately. Before taking this medication, it's important to discuss the benefits and risks with your doctor or pharmacist. And for the daily dosage and optimal timing, always follow the instructions on the label or as directed by your healthcare provider. Before taking ibuprofen, make sure to inform your doctor if you have any allergies to ibuprofen, aspirin, or other NSAIDs. Also, let them know about your medical history, including conditions such as asthma, blood disorders, heart disease, high blood pressure, liver disease, and kidney problems. If you experience dizziness or drowsiness while taking this medication, avoid driving or using machinery. It's also important to limit alcohol and stop smoking, as these habits can increase the risk of stomach bleeding when combined with ibuprofen. This medication may also make you more sensitive to the sun, so it's important to use sunscreen and wear protective clothing when outdoors. If you have diabetes or phenylketonuria, consult your doctor before using this product, as it may contain sugar and/or aspartame. For pregnant women, it's important to discuss the benefits and risks of using ibuprofen with your doctor. This medication may harm an unborn baby and cause problems with normal labor and delivery. It's not recommended for use after 20 weeks of pregnancy, and if needed between 20 and 30 weeks, the lowest effective dose should be used for the shortest possible time. Consult your doctor before breastfeeding while using this medication. Drug interactions can change how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ibuprofen Jr Strength 100 Mg Chewable Tablet include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and water pills, diuretics such as furosemide. This medication may also increase the risk of bleeding when taken with other drugs that may cause bleeding, such as antiplatelet drugs like clopidogrel, and blood thinners like dabigatran/enoxaparin/warfarin. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers. These drugs are similar to ibuprofen and may increase your risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. Daily use of ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. Talk to your doctor about using a different medication to treat pain/fever if needed. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. Remember to always consult with your doctor before making any changes to your medication routine. If you suspect an overdose and the person is experiencing severe symptoms such as passing out or having difficulty breathing, please call 911 immediately. Otherwise, contact your local poison control center for further guidance. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. Your doctor may order lab or medical tests, such as checking your blood pressure or kidney function, while you are taking Ibuprofen Jr Strength 100 Mg Chewable Tablet. It is important to attend all scheduled medical and lab appointments. Be sure to consult your doctor for more information about these tests. If you are using this medication regularly and you happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, then it's best to just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. This can be harmful and increase the risk of side effects. It's best to stick to the recommended dosage and timing for this medication to ensure its effectiveness and safety. It's important to store Ibuprofen Jr Strength 100 Mg Chewable Tablet at room temperature away from light and moisture, but not in the bathroom. Keep all medications out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product by consulting your pharmacist or local waste disposal company. And remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.